Good morning. I'm Dr. Adriana, and if you've noticed that mornings feel less reliable than they used to, if you wake up wondering whether your body will cooperate the way it once did, this conversation is for you. Today I'm sharing 3 small habits that urologists and researchers focusing on circulation and nervous system balance have observed can support morning performance in people over 60. You can start tonight. The 3 habits are a targeted evening hydration window with a mineral adjustment and a firm time cutoff, a calming pre-sleep breathing routine that takes under 2 minutes, and a discrete morning activation sequence you complete in 3 to 5 minutes without leaving your bedroom. I'll walk you through exactly how to do each one tonight and tomorrow morning, explain why they may help, and give you a simple 7-day tracking plan so you can measure your own progress. By the end of this video, you'll have everything you need to start seeing steadier mornings within 7 to 14 days. Let's start with the first habit, and I need you to pay close attention to the timing, because that's where most people make the critical mistake that ruins everything. Between 6 and 8 in the evening, drink 8 to 10 ounces of room temperature or slightly warm water with a small pinch of sea salt or a 1/4 teaspoon of a no-sugar electrolyte powder. The mineral addition helps your body hold fluid in circulation, rather than sending it all to your bladder within an hour. Then stop all fluids 90 minutes before you plan to lie down. If you normally go to bed at 10, your last sip is at 8:30. This window allows your kidneys to process the load while you're still upright and moving, so you enter sleep with better hydration balance and fewer middle-of-the-night interruptions. Continuous sleep matters because the deeper phases of rest are when your nervous system resets, your cardiovascular system stabilizes its tone, and the small blood vessels that serve pelvic tissues get their best chance to recover and maintain elasticity. Here's what most people get wrong, and I'll tell you the fix in just a moment. They drink that large glass of water at 9, lie down at 10, and wake up 2 or 3 times before dawn, completely destroying the restorative sleep their body desperately needs. The corrected version is what I just told you. Finish hydration 2 to 3 hours after dinner, then close the tap 90 minutes before bed. If you stop fluids too early, say at 6, you may go to bed already mildly dehydrated, which makes morning circulation feel sluggish. The second habit takes 2 minutes and changes everything about how you enter sleep. Sit on the edge of your bed just before you turn off the light with your feet flat on the floor and hands resting gently on your thighs. Close your eyes or soften your gaze toward the floor. Inhale slowly through your nose for a count of 4. Hold gently for a count of 4. Then exhale through your nose for a count of 6. Repeat this cycle 6 times. The entire sequence takes about 90 seconds to 2 minutes. And here's why this matters more than you might think. The slightly longer exhale activates your vagus nerve, the major pathway of your parasympathetic nervous system, which governs rest, digestion, and the relaxation of smooth muscle throughout your body, including in pelvic vessels. When you consistently signal your nervous system to downshift before sleep, you're more likely to enter deep sleep quickly, stay asleep longer, and wake with your autonomic nervous system still in a calm, balanced state, rather than spiking into stress mode the moment your eyes open. Many people over 60 wake up feeling either wired or foggy, and both extremes interfere with morning confidence. This breathing habit may support a smoother transition into wakefulness with better circulation and steadier energy. You may notice within 7 to 10 days that you feel more composed and present when you first sit up in the morning, and I'll show you exactly how to track that in a moment. Now the third habit, and this is the one that activates everything you built overnight. Within 5 minutes of waking, while you're still in bed or sitting on the edge, start by rubbing your palms together briskly for 15 to 20 seconds until they feel warm. Then place your warm hands over your lower abdomen, just below your navel, and hold them there for 30 seconds while breathing slowly through your nose. This gentle warmth and pressure can help wake up circulation in your pelvic region without strain. Next, while still seated on the edge of the bed, perform a short nasal breathing cycle. Inhale through your nose for 3 counts, exhale through your nose for 3 counts, and repeat 5 times. This oxygenates your blood gently and continues the parasympathetic tone you built the night before. Finally, stand up slowly, Hold on to a sturdy surface if you need to, and perform 10 gentle calf raises. Lift your heels off the floor, hold for 1 second, and lower back down. These activate the muscles in your lower legs, which act as pumps to push blood back up toward your heart and pelvis. The entire sequence takes 3 to 5 minutes and can be done in privacy without any equipment. This habit may support morning circulation, confidence, and readiness by giving your cardiovascular system a gentle, graduated start rather than demanding instant performance the moment you stand up. Now let me explain why these 3 habits work together, and this is where the science becomes practical. Your nervous system has 2 main branches: sympathetic, which drives stress and quick reactions, and parasympathetic, which governs rest, repair, and steady function. In younger years, your body shifted between these modes fluidly, but after 60, many people get stuck in a low-grade sympathetic state, especially if sleep is fragmented or stress is chronic. When you wake from broken sleep with your nervous system already on edge, morning performance suffers because blood vessels are constricted, hormones are out of rhythm, and your body is prioritizing survival over comfort. The evening hydration habit with a firm cutoff helps preserve sleep continuity, which allows your parasympathetic system to do its nightly work. The pre-sleep breathing routine actively signals that shift into rest mode, and the morning activation sequence gently coaxes circulation and nervous tone back into an engaged, confident state without shocking your system. Think of it as turning a dimmer switch rather than flipping a harsh overhead light. You're not forcing anything. You're supporting the natural rhythms your body wants to follow but may have lost track of. Some people notice a subtle improvement in morning steadiness or confidence within 3 to 5 days. Most see consistent results after 7 to 14 days, and a smaller number may need 3 weeks to adapt, especially if sleep has been poor for years. Let me give you the full protocol for tonight and tomorrow morning so you can start immediately, and I want you to write these timing windows down. Tonight, eat dinner at your usual time. 2 to 3 hours after you finish eating, drink 8 to 10 ounces of room temperature water with a small pinch of sea salt stirred in. If you dislike the taste, use a 1/4 teaspoon of a no-sugar electrolyte powder or add a squeeze of lemon. Sip it slowly over 5 to 10 minutes rather than gulping it down. Note the time, then stop all fluids 90 minutes before your planned bedtime. In that 90-minute window, you can brush your teeth and rinse, but avoid drinking anything else. About 10 minutes before you turn off the light, sit on the edge of your bed with your feet flat on the floor. Close your eyes and begin the breathing cycle. Inhale through your nose for 4 counts. Hold for 4 counts. Exhale through your nose for 6 counts. Repeat 6 times. When you finish, lie down and go to sleep as usual. Tomorrow morning, when you first open your eyes, stay in bed for a moment and rub your palms together briskly until they feel warm. Place your warm hands on your lower abdomen and hold them there for 30 seconds while you breathe slowly through your nose. Then sit up slowly and move to the edge of the bed. Perform 5 nasal breath cycles. In for 3, out for 3. Stand up carefully, holding onto something sturdy if needed, and do 10 gentle calf raises. That's your morning sequence. The whole thing takes 3 to 5 minutes. Afterward, proceed with your normal routine. If you drink coffee, wait at least 20 to 30 minutes after waking before you have your first cup, so your natural cortisol rhythm has a chance to establish itself without interference. Now here's the safety information you need before you start, and please pay attention if any of these apply to you. If you have diabetes, especially if you take insulin or medications that lower blood sugar, be cautious with the evening hydration timing because drinking too much too late can sometimes interfere with nighttime glucose stability. Consult your doctor before changing your fluid routine and consider using a smaller volume, perhaps 6 ounces instead of 8 to 10. If you take blood pressure medications, especially diuretics, the timing of your evening hydration and your medication dose matters. Some diuretics are meant to be taken in the morning precisely to avoid nighttime urination. Do not change your medication schedule without guidance from your clinician, and if you're already waking frequently due to a prescribed diuretic, ask your doctor whether a smaller evening hydration volume would be appropriate for you. If you have gastroesophageal reflux disease or GERD, lying down too soon after drinking anything can trigger symptoms. Make sure you give yourself at least 2 hours of upright time after your evening hydration, and consider elevating the head of your bed slightly if you're not already doing so. If you take anticoagulants or blood thinners, the morning calf raises are generally safe, but stop immediately if you experience unusual bruising, swelling, or pain in your legs, and consult your doctor. If you have pelvic pain, a history of pelvic surgery, or conditions like interstitial cystitis or chronic prostatitis, the abdominal hand-warming step may feel uncomfortable. You can skip that part and proceed directly to the nasal breathing and calf raises. If you have cardiovascular concerns, such as a recent heart event, uncontrolled high blood pressure, or significant arrhythmia, get clearance from your cardiologist before adding any new physical routine, even gentle calf raises. If you experience chest discomfort, unusual palpitations, or severe dizziness during any of these habits, stop immediately and seek care. If you have chronic obstructive pulmonary disease or asthma and the breathing pattern makes you feel short of breath or lightheaded, shorten the counts. Inhale for 3, hold for 2, exhale for 4, and do fewer cycles. Always prioritize comfort and safety over following the exact prescription. Let me offer 2 practical alternatives for people with common constraints, because I want everyone to be able to do this safely. If you have mobility limits and cannot stand safely to do calf raises, you can perform seated ankle pumps instead. Sit on the edge of your bed or in a sturdy chair with your feet flat on the floor. Lift your toes toward your shins while keeping your heels on the ground. Hold for 1 second, then press your toes back down and lift your heels slightly off the floor. Hold for 1 second and return to flat. Repeat this ankle pump cycle 10 times. It activates the same calf muscles and supports venous return without requiring you to stand. If you are sensitive to caffeine and even a morning cup of coffee disrupts your sleep, consider a warm non-coffee beverage such as herbal tea or hot water with lemon in the morning instead. The key is not the coffee itself, but the ritual of a warm drink and a brief pause before you rush into your day. Now, let me teach you the 7-day tracking plan so you can measure your own progress and know exactly what's working. Each morning, as soon as you complete your activation sequence, rate your overall morning readiness or first hour steadiness on a simple scale from 1 to 5, where 1 means you feel foggy, unsteady, or hesitant, and 5 means you feel clear, composed, and confident. Write down the number on a piece of paper or in a note on your phone. Also record whether you completed the full breathing cycle the night before, yes or no, and how many times you woke to use the bathroom. On day 1, you might write something like readiness 3, breathing yes, woke twice. By day 7, you might write readiness 4, breathing yes, woke once. That simple comparison tells you whether the habits are working. If by day 3 or 4 you see no change at all, check your timing. Are you stopping fluids 90 minutes before bed, or are you stretching it to just 60 minutes? Are you doing the breathing cycle sitting upright, or are you lying down already and rushing through it? Small adjustments in timing and posture can make a noticeable difference. At the end of 7 days, I encourage you to share your results in the comments. Write something like, Day 1 readiness 3, woke twice. Day 7 readiness 4, woke once. This kind of sharing helps other viewers see real outcomes and motivates everyone to stay consistent. Here's a story that shows you what realistic progress looks like, and I want to set proper expectations. I worked with a gentleman in his late 60s who had spent 2 years feeling increasingly frustrated by unreliable mornings. He described waking up feeling either wired or completely flat, never in between, and he had lost confidence in his body's ability to respond predictably. When we introduced these 3 habits, he was skeptical because they seemed too simple. But within 10 days, he noticed that he was waking up only once per night instead of 3 times, and his morning readiness felt more stable. He said it wasn't that he suddenly felt 20 years younger, but that he felt like himself again, like his body was cooperating instead of resisting. That's the realistic outcome I want you to expect. Not a miracle, but a return to steadiness, predictability, and dignity. Let me address one more thing before we close, and this matters if you've tried quick fixes before. If you're someone who has relied on performance-enhancing supplements in the past and found them unpredictable or unsettling, these habits offer a different approach. You're not adding anything artificial to your body. You're supporting your natural rhythms with timing, breathing, and gentle movement. The benefit builds over days and weeks, not minutes, and because it's based on physiology rather than chemistry, it tends to be more stable and forgiving. If you miss a night, you simply pick it up again the next evening. There's no withdrawal, no rebound, and no dependency. Let me bring everything together so you can start tonight with complete clarity. 2 to 3 hours after dinner, drink 8 to 10 ounces of room temperature water with a small pinch of sea salt or a 1/4 teaspoon of no sugar electrolyte powder. Stop all fluids 90 minutes before you plan to lie down. 10 minutes before bed, sit on the edge of your bed and perform 6 cycles of the calming breath. Inhale through your nose for 4 counts, hold for 4, exhale for 6. Tomorrow morning, while still in bed, rub your palms together until they're warm. Place them on your lower abdomen for 30 seconds, sit up, and do 5 nasal breath cycles of 3 counts in and 3 counts out. Then stand carefully and perform 10 gentle calf raises or 10 seated ankle pumps if standing is difficult. Track your morning readiness from 1 to 5. Note how many times you woke in the night and write it down. Repeat this sequence every night and every morning for 7 days, then compare day 1 to day 7. This is education, not medical advice. If you have diabetes, blood pressure concerns, GERD, take anticoagulants, have pelvic pain, cardiovascular conditions, or sleep disorders, consult your clinician before starting. Stop immediately if you experience unusual palpitations concerning dizziness, chest discomfort, persistent breathing difficulty, or unstable blood sugar, and seek care. If you found this helpful and you want more practical, evidence-informed guidance for senior health that respects your intelligence and your dignity, please subscribe to Dr. Adriana Bayon Senior Health. Start tonight with the evening hydration and breathing routine. Start tomorrow morning with the activation sequence. Track your progress for 7 days and share your results in the comments so we can learn from each other. You deserve mornings that feel steady, predictable, and confident. And these 3 small habits may help you get there. Thank you for watching.